So carpal tunnel is one of the most common compression neuropathies that we have and that we deal with. The nerve passes through a tunnel in the wrist, and it passes through the tunnel in the wrist with tendons that control flexion of the hand. So it passes through the wrist with tendons that control the muscles of the hand, and what happens is over time those muscles and those tendons can get larger and making less room for the nerve, so the nerve starts to get compressed, and that manifests as numbness and tingling in the first 3 fingers of the hand, and sometimes in the outer side of the ring finger, some muscle wasting and occasionally pain. Worse at night, worse when you elevate your hands, and that's typically what we call carpal tunnel syndrome. So what you can do is go in and release the tension band on top of those tendons and the nerve, releasing that pressure, and then the nerves decompress and the symptoms go away. Classically, the demographic affected is women in the 40s to 50s range, but we're seeing it in more and more people, younger as well as older, with the activities that we kind of encounter with all the typing and the things that we do and the repetitive motion that is common in the population today. The majority of people need non-surgical intervention, splinting and anti-inflammatories, and then if they don't get better with that non-invasive approach, then surgery is very easy. It's an outpatient procedure. You usually do one hand at a time. For patients that the conservative management doesn't work or they become more symptomatic, the surgical option is there. It's very simple. It's outpatient surgery. It's very well tolerated, and there's a very, very high satisfaction rate of relief of symptoms following the procedure. There's many different ways to do it, but essentially it's a simple incision and just a release of the tissue overlying the nerve, and when it releases that tissue, it decompresses the nerve and patients go home very happy. Activities takes a little bit of time to get back to. You'll need some therapy and some physical therapy. We want you to take it slow, 6 to 8 weeks, and typically patients are well on their way back to their previous baseline, but now numbness, tingling, and pain-free.